It started. Yeah.
7-1.
Yeah. Okay. Okay. All right. Yeah. Okay. So let us know, okay, when we are ready to go live. Post it on the group, okay? Then we will know. And then also post the live questions, okay? Bye. Yeah, we are live. Yeah, we are live. Yeah, it's okay.
Hi everyone. Today we're talking about something important. Dental health is something that matters to all of us. I'm Shy and I'm excited to be your host for this live show. We've got a great show lined up for you. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry and how to keep our teeth healthy and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas, and guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and now welcome Dr. V and start our show.
All right. Okay.
All right.
Okay. All right.
All right. Well,
Hi everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm so excited to be here with you all today. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that surround your teeth. And I'm also skilled in dental implants and oral surgery. I'm also a part of the American Academy of Periodontology and the American Board of Periodontology. That's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have 4 offices, as you guys know, in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have. about your teeth and gums, and you can ask your questions live here right now, or even send them in for our next show. Your questions really help us make these shows really helpful for not just for you, for everyone. And one more thing, if you like what you're learning here, please let us know. Your feedback is super important to us. And don't forget to like and subscribe to our channel so you won't miss out on the latest and greatest updates and helpful tips for your dental health. I'm looking forward to talking to you and answering as many questions as possible. Let's make our smiles the best they can be. Let's get started.
All right, let's go. All right, so our first question, doctor, is it normal for my tooth to move a little bit when I push it?
So it's okay for the teeth to move slightly, just because you have what we call it as a mobility. It does not mean that there may be something wrong. But what I don't know is when you say, like, when you're pushing, it is on the slightest touch, like it is going inside or going outside, as opposed to when you are starting to put a lot of pressure that goes in. So what we normally do as dentists, when you come into our office, and we use either one handle of what we call it as a dental mirror and a finger, or we put two fingers to kind of see whether we can wiggle the tooth, or we put some pressure on the top of the tooth to see how much, like, the tooth goes inside or out. So without seeing you, I can't really answer your question whether it is okay for you to push your teeth and the tooth can be pushed. So whether it can push inside too much or whether you can push it inside or outside too much is what's going to matter. And the simple answer to that is see your dentist or your periodontist to see what is going on to get the right answer. That way you end up not losing your teeth, because the biggest challenge is if the tooth moves too much, and at some point you may end up losing your tooth.
That's right. We see it all the time. Alrighty. We'll keep it going. Doctor, all my teeth have been pulled and I've healed, but I'm not using dentures yet. I'm experiencing swelling and pain similar to a toothache. How is this possible?
And if you had your tooth extraction, not always the things are going to completely heal, or it is going to take within like a period of time. It may take some time, a longer period of time for you to heal. So if you are still experiencing pain after the tooth extraction, it is very possible either you may have what we call it as a dry socket, which is not uncommon, or you may have some kind of an infection, or it is very possible you may have like a small bone spur, or the bone which is exposed, which may not be completely, the gum may not be completely healing over that, and which may be causing the pain. My recommendation is if talk to your dental office. You don't have to do like immediately go in. Talk to them and then see what happened during the dental procedure, whether it was a simple extraction or a complicated extraction, and whether they are expecting or whether they were expecting whatever that you are experiencing. And it's not uncommon for you to, because if it is a complicated extraction and whatever you're experiencing is not uncommon. So again, the simple answer is check with your dental office, whoever did the extraction, to see whether you can expect those things. And if they feel like it is possibly a complication, you will have to go in to get that checked out with your dental office.
That's right. Don't wait too long, buddy.
Right. Absolutely. Yeah.
I've noticed some white patches inside my mouth that don't hurt but haven't gone away. Could this be a sign of oral cancer?
Great question. I'm so glad like you are watching your own mouth, and which is one of the main things that we always tell our patients. And always keep a watch on your mouth. Anything that you see, particularly any lumps or bumps that you see on the inside the mouth or outside the mouth or anywhere in the face, head or neck, anywhere, not just the face, head or neck. I know, although we are talking about dentistry, that's what I'm talking about, the face, head or the neck or inside the mouth, but even anywhere in the body, it's just not normal at all. So we ask the patients to watch for any lumps or bumps or any sore spots. The sore spots could be either again inside the mouth or just around the mouth or like in the head or neck anywhere or any other part of the body for a fact, right? So any lumps or bumps, any sore spots that you have or any patches you have, it is not normal at all. So what we normally do in our office is any patients who have white patches, we do what we call it as a simple biopsy. So we take a small sample of the tissue, send it to the oral pathology lab to get a good diagnosis. A lot of times this could be either no cancer or could be pre-cancer. Unless you have waited too long, it is very possible it could be cancer as well. But from the sound of it, that does not sound like an invasive cancer, but it is very possible it could be a pre-cancer. So the simple answer is get it checked out with your dental office to see whether you need a biopsy, and when they do a biopsy, they should be able to report back to you to tell you what kind of a lesion it is.
That's right. All right. Questions are coming in hot.
Awesome.
Really nice. All right, doctor, it's been 6 days since my wisdom teeth were removed, and I have a persistent, horrible taste in my mouth, reminiscent of a bloody scab. Despite brushing, using mouthwash, and rinsing with salt water, nothing helps. The bad taste and smell won't go away. Is there any remedy you can suggest?
One of the most common complication after the wisdom tooth extraction is what we call it as a dry socket. Having said that, normally we expect the dry socket to happen anywhere between 48 to 72 hours, and that's where the bad smell or the bad odor or the bad taste starts happening. But having said that, it is possible that it started after 3 days and then now you're still feeling it on the 6th day. It is very possible it could be the dry socket. If it is not dry socket, it is very possible you may be having some infection, which means you may be having some discharge of like either some bloody discharge or like a pus discharge, which could be causing the bad odor or the taste that you are experiencing. Or it is very possible it not a dry socket, it is not infection, it may be just that the food some food got stuck in there. The food is now causing the bad odor or the bad taste that you may be experiencing. You don't need to be suffering from any pain or discomfort. The simple answer should be talk to your dental office, whoever did the extraction, or the surgical office, whoever did the extraction for you. Ask them, and better be safe than sorry. Get it checked out whether you have an infection or a dry socket or any other conditions which may be causing concern, and they should be able to help you out.
All right, looks like we have a rolling theme tonight. Why am I experiencing pain under a cap tooth?
So I'm laughing here because it's one of the common questions, and because people think that once they have what we call it as a crown or a cap on a tooth, they think it is foolproof and you cannot get a cavity or you won't get a cavity. So what happens is when you get a cap or a crown, there could still be some what we call it as a micro leakage under the crown, and particularly if the crown was not fit right, which we commonly see when things are not being done to the standard of care, and when we see that when the crown keeps seeping or the infection keeps seeping under the crown, you may still get cavity under the cap or under the crown. And when you have the cavity that spreads under the crown or under the cap, then that's what causes pain, although your tooth is capped. So the answer is go see your dentist as soon as possible before it becomes too late, to the degree that they cannot salvage the tooth at all. So now it is possible they may be either able to do what we call it as a root canal through the crown, or they may be able to remove the crown and inspect the tooth to help you save. So go see the dentist and they should be able to help you.
That's right. Go see the dentist. Okay, Dr. Vadivel, does ToothHQ free oral cancer screening include checking for tongue cancer and the areas around the gums and the jaw? What tools or methods are used during the screening?
Absolutely we do. We do for every single patient that comes into our office. And as you know, we offer the free CT scan and the free consultation, and that includes the free oral cancer screening also. So what we generally do is we visually inspect inside all the mouth and outside all the mouth, which we call it as an intraoral exam, intraoral cancer screening, an extraoral exam, and extraoral cancer screening. And then we do have special tools, and there are multiple tools available. We call it as a well scope, or we call it as an identify, and we call it as a VisiLight. So there are multiple screening tools available. That are available. The one tool that we use, we call it as an identify. That's the tool that we use for oral cancer screening. So again, it is a great question, and so if you happen to be in the Dallas-Fort Worth area, sounds like you are, because that's why you're asking about ToothHQ. Come see us, and we'll be glad to do a cancer screening exam and a free consultation and a free CT scan.
That's right. Absolutely. Come see us. Okay, you guys, be sure to send in your live questions. My doctor mentioned that periodontitis has caused my tooth swelling. What exactly is this condition?
So, I'm glad like you pronounced it wrong, right? Periostitis, right? So what that means is...
I was so close.
Yeah, you're close. Yeah, you're close. Yeah.
Periostitis.
Yeah.
Ostitis.
Yeah, right. Okay. So what periostitis means, like when you have a tooth, right? The tooth. This is a tooth here, and over the gum, over the tooth lies the gum, or over the tooth lies the bone, and then the gum lies over that, and when underneath the gum, before it touches the bone, and there is what we call it as a periosteum. So what the doctor may be referring to is there is some kind of an infection between the bone covering the tooth or the root and the gum line, and there may be some kind of an infection. And what needs to be done, without getting too much into detail, whether it is a periostitis or something else is going on, and you need to get that taken care. So whatever the doctor was recommending as part of like either the diagnosis or treating or getting you out of pain, my recommendation is talk to your dentist and see what they can do to help you.
Absolutely. That's right. Okay. So we are going to get into our first live question. All right. What flossing tips would you, Dr. V, recommend for optimal dental health?
All right. Okay. So the flossing tips, at the minimum that we recommend, I'm laughing here because what I hear from people is, and they tell me like, what this is one of the standard questions that we ask whenever patients come in for a cleaning or their maintenance cleaning, what we call it as a periodontal cleaning. And I generally ask them, hey, how is your brushing and flossing going? They're going to say, great. And then I ask the question followed by that, oh, so are you flossing, are you brushing twice a day, and are you flossing twice a day? Well, they say, what do you mean? Like, well, I brush twice a day, but possibly like flossing maybe once every couple of days. So are you really doing like once every couple of weeks or a few times a week? And they will say, well, maybe a few times a week. So that's the challenging part. To begin with, I want you to start flossing and start the flossing habit at least once a day. You definitely need to be doing twice a day, once in the morning or before you go to bed. But if not, at least you need to do once a day. What happens is the plaque turns into what we call it as a tartar, which takes about 24 hours for the plaque to turn into tartar. So if you break the cycle and then if you break the plaque away, then it is not going to form into tartar. But if you are doing once every 48 hours, or if you are doing 3 times a week, then you are allowing the plaque to turn into tartar. So the flossing is not going to be as effective. So once you get into the habit of flossing twice a day or at least once a day, then what matters is whether you are wrapping the floss around the tooth. So what generally people do is they go up and down, up and down. But if you look at the tooth has a shape. It's like a U shape. So what you need to do is to take the floss and then wrap it around the tooth. After you wrap it around, now you go up and down. Now you go up and down. And then The same thing, there is a back tooth. So you floss it, the wrap the tooth around the back tooth, and then you go up and down. So go down, wrap it on the back tooth, go up and down, come forward, wrap it on the front tooth, go up and down. That's the proper way to do the flossing.
That's right. It's a workout.
It is a great workout. Yes, correct.
Perfect. Well, keep sending in questions and we'll jump back into the comments. But we'll go back into our sent in questions. My father had oral cancer and I'm worried about my risk. What symptoms should I be on the lookout for?
So anytime you have oral cancer, or you thinking that you are going to be looking out for oral cancer, the main thing that we say is you need to be looking for any kind of lumps or bumps inside or around or outside the mouth, and you also need to be looking for any kind of sore spots inside the mouth or around the mouth or outside the mouth or anywhere in the face or head and neck area. So particularly if your father had oral cancer and if you are concerned, you definitely need to be doing what we call it as a self-exam, looking for these lumps or bumps or sore spots or even patches inside the white or red patches inside the mouth. And you definitely need to be going into the dentist every 6 months. And don't think that you can be self-diagnosing, because sometimes you might miss. And don't think that because you're going into the dental office and you're not going to get something the day you get out of the dental office, you may be getting something. So it is critical that you do your self-exam and you also go to the dentist for the professional oral cancer screening, depending on what your condition is, whether you need to be doing every 3 months or every 6 months. So they both are critical, particularly if you have a family history of oral cancer.
That's right. All right. Get your oral cancer screening.
Absolutely.
Okay.
Yeah.
All right. Doctor, I am planning to undergo laser gum depigmentation. Is the procedure safe and will the pigmentation return over time?
Great question. Laser depigmentation, it is one of the techniques that is becoming very popular nowadays, particularly with increasing availability of the laser all around the world and in our office, and we do it all the time. The laser treatment, we do it all the time in our office. To answer your question, yes, the laser depigmentation is effective, and depending on whether how dark your gums were before you started, so the chances are the pigments are going to come back. Not always, but there is always a possibility. We say this all the time in medicine. Hey, we are dealing with the biological organ and your body. We can't guarantee on anything that we do. Although we know before we do the procedure, what we call it as a prognosis, we can predict the prognosis, but we can't guarantee a prognosis. So to answer your question, the depigmentation or removing pigments is effective, and how long it is going to take, it could be multiple years before it comes back, and the answer depends on how dark your gums were pigmented before you got started. Again, talk to the surgeon or the periodontist or the dentist, whoever was doing the procedure, and they should be able to give you your prognosis.
That's right. Well, best of luck to you.
Yeah, thank you.
Not to you.
No, I'm saying, yeah. Oh, thank you for giving them best of luck, I said, yeah.
Okay. All right. Doctor, what options do I have if I have a crown over a root canal tooth, but now my gum is inflamed and I have a 5mm pocket? A CT scan showed the root canal extends 2 millimeters too far, and my dentist recommends extraction. What can I do?
Well, if you already have a root canal over a crown tooth, and a lot of times, again, without knowing the specifics, and looks like what we call it as an overextended root canal treatment is what we normally say. So sometime if you have an overextended, it is possible that you can do a root canal and then remove the existing root canal through the gum, through the crown that you already have. Remove that filling, and you can do a root canal. And if that is not possible, then what we call it as an apicoectomy, what that means is we go about, like let's say if this is the top tooth, for example, and the root canal is extending far beyond the root, so then we open up the gum line and we go and we remove what we call it as an apicoectomy. We go to the end of the tooth, end of the root, and we remove the extended material and also a part of the root, and then we seal it from above. We call it as an apicoectomy. So those are options that are possible, but if your dentist is already recommending the extraction of the tooth, and again, without knowing the specifics of the condition, I can't tell you whether you can be treated doing a root canal or an apicoectomy before considering an extraction of the tooth. Doing extraction, it's not like a bad idea either, because even after doing a root canal and doing an apicoectomy, if your prognosis is guarded, and even I may be recommending doing an extraction followed by implant placement also. So either you need a root canal or an apicoectomy or an extraction followed by implant, your dentist should be able to recommend that for you.
That's right. Go see your dentist. Okay. Doctor, I always hated the idea of getting false teeth. Could laser be used instead to treat my advanced tooth decay and gum disease?
Absolutely. So the short answer to your question is the laser can do wonders. Laser can be used to treat the tooth decay. Laser can be used to treat the gum disease. So depending on the severity of your tooth decay, the dentist should be able to determine he can use the laser or he needs to do any other treatment, any other tools to treat your decay. So the answer is laser can be used to treat the tooth decay and the gum disease, and we do it all the time, in our office to treat the gum disease, and that's what we do. So if you happen to be in the Dallas-Fort Worth area, come see us and we can definitely help you.
That's right. Alrighty. Okay, let's see here. Is there a specific diet or supplement that can help reduce my risk of developing oral cancer?
There are multiple studies have been done, although it has not been proven. What are all the things that could help you with preventing oral cancer? For example, people recommend doing a lot of fruits and vegetables, because these fruits and vegetables that are rich in antioxidants and vitamin A and vitamin C and vitamin E, those can really prevent the oral cancer. And the omega-3 fatty acids, the either some supplements or the food that are rich in omega-3 fatty acids, like the fish and the flaxseed and the walnuts, they can help you also prevent the oral cancer. Green tea is a great one, which has a lot of what we call it as polyphenols, and that is really helpful to prevent the oral cancer also. But the goal is more than looking at the supplements. People always are looking for shortcuts, right? They smoke and they drink and then they don't go to the dentist on a regular basis, and though they are looking for shortcuts, right? So I would recommend, if you are smoking or you are drinking, avoid those risk factors, which is very critical before you start considering the supplements, the ones that we mentioned, like the fruits and vegetables and the supplements like omega-3 and all of that, before you start considering. And then even processed foods can be putting you at a risk for oral cancer. So avoid those as much as possible as well.
That's right. Go get your screening.
Absolutely. Yeah.
Perfect. All right, so we're going to jump into a game. Are you ready?
Oh, yeah, sure. I forgot about that.
Yeah.
The rapid fire question.
That's right. So you have to answer the question within 1 to 2 sentences.
Okay.
All right.
Okay.
I've been a smoker for 10 years and recently quit. Should I get screened for oral cancer, and how often?
Absolutely. Just because you recently quit, you can't say that you are never going to get oral cancer. So get your screening done every 3 to 6 months. Go to your dentist to get that done.
Go to your dentist. All right. Can oral cancer cause changes in voice? I've noticed my voice has become hoarser without any cold or flu symptoms.
Absolutely. So one of the changes that happens with oral cancer is if oral cancer goes into the back of the throat, and it definitely can change your voice. Again, the simple answer is get it checked out so you're not missing anything really serious.
That's right. Go get a screening. All right. How effective are DIY oral cancer screening kits? Are they a good substitute until I can get to a professional?
So the DIY oral cancer is better than nothing, right? So if you have access to the DIY kits, yeah, absolutely go for it. But it is not a substitute for a professional oral cancer screening. So after doing that, make sure that you are going to see the dentist for a professional oral cancer screening for sure.
That's right. Go see your dentist. All right. So we're going to jump back into our viewer questions, and then we'll jump back into the comments. So is crown lengthening advisable for a 60-year-old diabetic patient? Straight to the point.
Absolutely. The real answer is yes. Absolutely. Crown lengthening is not contraindicated on any patient, whether you are an 18-year-old or 80-year-old or a 90-year-old. It does not matter. So go for it if it is indicated, if it is recommended by your dentist and your periodontist. Absolutely. Yeah.
That's right. Okay. Doctor, I've heard that laser treatment outcomes can be just as effective, if not better, than implants, which some dental offices claim have a 99% success rate. Is that accurate?
The answer depends on the how advanced your bone loss or how advanced your gum disease is. So can laser procedures can be as effective or better than implants? Sometimes the answer is yes. People come to our office all the time, then they don't want to remove their teeth, and they want to keep their natural teeth, and we talk to them about how the laser can be an alternative option to keep their teeth for a long period of time. So whether the laser is going to be as effective as dental implant, absolutely. Whether can they have a 99% success rate? Absolutely, they can have a 99% success rate, particularly after the laser treatment, that you follow through with your dentist or a periodontist to make sure that your gums and the bone levels and the teeth are all stable enough.
That's right. All right. As someone who wears dentures, I often get irritated spots where they rub. Could this irritation turn into cancer?
Absolutely. In the past, like what we used to think that anytime you wear denture, the denture is what causes the cancer. That's kind of a myth. Just because you're rubbing the denture against your gum tissue or your mouth tissue, that itself is not going to cause cancer. But what happens is when you keep rubbing, and that exposes your tissue, and now whatever the chemicals we talk about, like these processed food and smoking and the alcohol, now your tissue becomes so prone because of the open wound that you have, or the thin gum tissue or the thin mouth tissue you have. Now you're more prone to getting an oral cancer. So to answer your question, can denture wearing itself can make you prone? It is very possible, particularly if it is rubbing against your tissue. Absolutely.
Yes, so please be careful. Doctor, my teenager is going through a lot of hormonal changes. Could these changes be causing any specific gum or teeth problems that we should be aware of?
Absolutely, yeah. So one of the common things that we see is anytime we talk to the teenage kids, anytime when they have go through the periods, and there is a lot of hormonal changes that happens in the body, and it happens more often on the pregnant women because they go through like a lot of hormonal changes. One of the most common things that they complain is their gums bleed a lot during the pregnancy period, and we are aware of that. That is because of the hormonal changes. So when you are going through a pregnancy phase, again, make sure that you are going to get to your dentist and to get your cleaning, because you want to prevent the gum disease causing any kind of pregnancy complication such as preterm birth or the low birth weight or any other pregnancy complication. And particularly if you are going through your periods, and if you're having discomfort before you get your periods and get your kind of cleaning, just schedule it around that time, so that way your gums are not going to be hurting because of the hormonal changes during your periods.
That's right. It's all connected. Can aggressive brushing lead to swollen gums and the formation of an abscess?
So the aggressive brushing alone, I'm not going to say it is not straightly connected, but what is possible is when you do aggressive brushing and you may be brushing or you may be taking too much of gum away, then now you're making the gums to recede around, recede away from the tooth or pull away from the tooth. And a lot of times when it recedes so far into the gum line or around away from the tooth, so when the gum tissue becomes really thin, now the real thin gum tissue becomes really prone to irritation, and particularly when you form a lot of plaque or the tartar around that really thin gum tissue, that can lead into an abscess. So it is not a direct effect of you brushing your gums too hard that causes the swelling or an abscess, but it could become an indirect effect over a period of time because of the receding that is being caused, and that is leading to a lot of plaque and tartar formation and hence an infection, and that can lead into an abscess. Absolutely, yeah.
Absolutely. If you experience one, go see your dentist. Doctor, I've noticed that I have a gummy smile. Could you please help me understand what's causing it in my case and what treatment options might be there for me?
So the gummy smile is caused by either it could be like a genetic makeover. You probably got it from because of your genetics, or your teeth when they come through, like they did not push all the way through, or when you probably did not get the braces done at the right time, or you never had braces. So there is a variety of reasons why the gummy smile can happen. So whether do we have options to treat your gummy smile? Absolutely. So there are a variety of options, and what we call it as a gummy smile correction, what we call it as an aesthetic crown lengthening in our dental terms or the periodontal term, that can be done to correct your gummy smile. And sometimes if your gummy smile is too big, sometimes you may need to have what we call it as a orthodontic surgery or a combination of braces, and then you need to have some kind of a jaw surgery to be done. So whether you are, depending on your gummy smile, again talk to a dentist whether you are a good candidate for getting what we call it as an aesthetic crown lengthening or a gummy smile correction surgery. And if you're not a candidate for that, then again talk to the dentist about whether you need to go see an orthodontist and possibly have a combination of braces as well as the jaw surgery, what we call it as an orthodontic surgery, to correct your gummy smile. But absolutely there are so many options that are available. And sometimes we also, to kind of just to mimic, we call it as the laser procedure to reposition the lip also, and that is very possible. Although the relapse rate is what we call it as a relapse rate, it might come back after a while, but that is possible also, can be done.
So many options. Definitely look into it. My wife has gum recession around an implant. Can laser treatments help with this, or should we go for a new implant, which is better and cost effective?
It's not uncommon. Sometimes we see the gum recession around the implants, and just because you have a gum recession, that doesn't mean that the implant needs to be removed. And it is very possible, depending on the age of the implant and the position and whether you have any kind of a bite issue to begin with, that multiple things could have caused the gum recession. First thing is to correct or to prevent this from getting worse. So you need to find out if it is a bite issue. No matter whether you're going to get a new implant or whether you are going to correct the gum recession around that, it is still going to make it continue to make it worse. So in addition to correcting it, also you need to prevent that by doing whatever is causing that. So once we understand the reason why it happens, we can help prevent that in the future. Plus, if you have just a gum recession, you don't need to get the implant removed. A lot of time, whenever you have gum receding around the tooth, what we do is the gum grafting procedure, we either borrow the gum tissue from the roof of the mouth or from the skin bank to put around the tooth. The same way, the gum grafting using either your own gum tissue or the donor tissue that comes from the skin bank can be put around the implant also to correct the gum receding.
That's right.
Multiple options.
Multiple options. Absolutely. All right. So we're going to jump back into the comments. Thank you guys for your live questions. Our second live question of the night: is it possible for braces to correct occlusion, smile appearance, and reshape the face after puberty? When is it too late to fix all of that?
It is never too late is the answer. So we have, we tell our patients all the time, and I have patients who are 18 who have braces, and I have patients who are 80 years old who have braces. I had a similar discussion with a 55-year-old lady who said, "Hey, when I was growing up in another part of the world as a kid, I didn't have the privilege of getting braces, and am I too old to get braces now? I'm 55, and particularly I don't want to look like a teenager with having all the metal in my mouth. And is there any other option?" So I told her, absolutely. Just because you are 55 and because you didn't have the privilege of getting braces when you were younger, that doesn't mean you can't get them now. You can absolutely get them now. And also, you don't have to be afraid to embarrass yourself, like because you have a lot of metal in your mouth, like because people are thinking that you are too old. You don't have to do that. Now we have what we call it as an Invisalign or invisible braces. They look like these where is our retainer here? Do we have one? This is our night guard. They look like this, similar. So these are clean. These are clean ones. So you can wear them above your teeth, and nobody knows that you are getting braces. And these braces and the top of, like when you wear them on the top of your teeth and around the gum line, they move the teeth around. So you are absolutely a candidate, and you can definitely talk to your dentist or the orthodontist to see whether you are a good candidate. Absolutely, you can.
Perfect. Again, more options. All right. I've been having a persistent sore throat and difficulty swallowing. Could these be symptoms of oral cancer, and should I be screened?
Answer is yes. Yeah. Persistent sore throat and difficulty in swallowing are one of the two common things that we normally tell our patients to watch for whenever you're looking for symptoms of oral cancer. Yeah, you're difficult, and particularly if the difficulty has not gone away within a period of like 2 weeks, or if you're having consistent soreness over a period of 2 weeks, and you definitely need to get it checked out, and definitely get it checked out with the dentist. If not, definitely go to your physician or anybody you have access to get it checked out immediately. My recommendation.
That's right. Don't wait. Okay, we'll keep it going. Post your live questions for us. What exactly is a root canal, and when might it be necessary to consider one?
So a root canal is just like it sounds, right? You already had a root canal, and then now you need to get it redone again. So that's what a root canal is. So, and this is one of the most common things, people ask us, and I already had all my nerve removed from within the root canal, and why am I getting, I don't have any nerve, why am I getting any infection? So whenever we do whenever we do the root canal, there is always, what we call it as, this is the main, what we call it as a main nerve trunk, and then we have what we call it as a tiny lateral canal. So we cannot remove the nerve from all those canals. So it is not a foolproof procedure. We tell them all the time. So I tell my patients, a root canal is like a ticking time bomb. You never know when it is going to explode. I have seen root canals last for 30 years, and I've seen them last only for 3 years. Again, it depends on like a lot of factors, how bad it was before you got the first root canal done. So to answer your question, so to do the root canal, what that means is, so you get the infection on the existing root canal, and now you need to get the to root canal treated, and whether it is necessary for you to get a root canal. Again, depending on whether your dentist is comfortable, they should be able to do it in their office, or a lot of times the dentists do the first root canal. When it comes to what we do, what we call it as a root canal, they may be referring to an endodontist or a root canal specialist to consider getting a root canal. And if your endodontist tells you that you have one or you need one, absolutely go for it.
That's right. Salvage it if you can. Okay. Keep sending in your questions. We'll probably do another before the end of the night. I've had some bone loss and I'm worried about prosthetics. Would laser provide a safer treatment option in my case?
Very, very genuine concern. Whenever it comes to losing a tooth, people are concerned emotionally. They don't want to lose a tooth. Number two, when they are going to lose a tooth and they don't want to consider any type of metal to be put in the mouth, although it's not a bad idea, or it is a very safe procedure. Still, people have some kind of thoughts about having a metal put in the mouth. And if you have a genuine concern, can laser be an alternative option? Absolutely, we do it all the time. So, as periodontists, this is what we say. We are all about saving the teeth, and that's what, like we said when the first show started, we are all about saving the health of your gums and the teeth and the bone that surrounds the tooth, and that's all we are all about. So, to answer your question, yes, laser can definitely help save the gum tissue. You can prevent a dental implant. And it is not an unreasonable request. Talk to your dentist or your periodontist whether you are a candidate for getting a laser procedure done to save the tooth, and it is definitely an alternative option.
We'll lay out your options and best of luck. Okay, so before we come to an end, we'll definitely jump back into the comments. We have another live question. I saw that ToothHQ offers a free CT scan. You've definitely been watching. Is that the same as a regular dental x-ray, or is there a difference?
Great question. Sounds like you are in the Dallas-Fort Worth area. You've been following us, and so come see us definitely. To answer your question, whether it is the same as a regular dental x-ray or a different one. So normally when we call it as a 2D, meaning like a two-dimensional, or like a flat x-ray, which is the regular dental x-ray that you get anytime you go to the dental office. It used to be not common for the dentist to carry the 3D CT scan that we normally do, but now with the technology kind of like getting spread and around and become more commonly accessible, even the dental offices do have the 3D CT scan. So yes, there is a huge difference between the 2D panoramic x-ray and a 3D CT CAT scan. So what we are able to do is we are able to view everything in a three-dimensional form and slice and dice the tooth. And we can go into cross sections and look at each and every part of the tooth inside the bone, and what we call it encased in the bone, using the 3D CT scan. So there is a huge difference between the 2D and the 3D CT scan. Come see us at ToothHQ. We can definitely help you.
That's right, at no charge.
At no charge, exactly. Yeah, thank you for reminding me on that.
Absolutely. Okay, I have a small lump under my jaw that hasn't gone away. Should I be concerned about oral cancer?
That is absolutely one of the common reasons. And whenever I teach a lot of classes to my general dentists who I work with. Matter of fact, like we just had a class like about 2 or 3 weeks ago that I was teaching to my dentist colleagues, and that is one of the most common things that we recommend watch for. So one of the most common areas where you are going to get the oral cancer is what we call, the most risky area you are going to get oral cancer is under the tongue, which we call it as the floor of the mouth, or on the tongue, on the sides of the tongue. when you get the cancer on the floor of the mouth, which is the most risky and a common area, or on the tongue, which is again the risky and a common area, you have the blood that drains, or the lymphatic system that drains into underneath the jaw here. So you're going to feel like you got some swollen glands, and guess what? The cancer have already spread if you have been waiting to get the cancer checked out. So if you have been feeling some lumps, and you probably are feeling some kind of an ulcer in the tongue or on the floor of the mouth, it is very possible the cancer is starting to spread. And part of the oral cancer screening exam that we do, whenever we do in the office, we check inside the mouth, and particularly we check outside the mouth and look for the lumps inside. And if you already have an ulcer, we are again very thoroughly checking to see whether it has already spread. So sounds like you need to get that checked out with your dentist as soon as possible.
That's right. Go get a screening. Okay, doctor, does ToothHQ provide laser treatments for tooth remineralization?
Teeth remineralization. So what the tooth remineralization means, the teeth got like what we call it as a white spots on the teeth, and sometimes it is visible, sometimes it may not be visible. Irrespective of that, when you have remineralization, and the laser can be used for laser whitening procedure also, which is getting very popular nowadays. People want instant answers, so the laser can provide instant answers, and laser can be used to do the teeth whitening also. And one of the most common reasons why people do the laser whitening is the remineralization. So laser can help you with the remineralization process. Whether you're a good candidate for doing this laser tooth whitening or teeth whitening, is talk to your dentist who specializes in laser.
That's right.
If not, come see us at ToothHQ.
Yeah, come to Dallas.
Yeah.
Okay. What are the most common locations in the mouth for oral cancer to develop? I think we talked about
We
this.
just talked about this, right? So the most common areas, if you watch the previous question, I told you we were teaching a class. I was teaching a class to my dentist colleagues, and we talked about it. And most common areas are the tongue is one of the most common or a notorious area, and the what we call it as under the tongue, which is the floor of the mouth, which is the most common area that you may get oral cancer. The lips and the cheeks and the hard palate, meaning the palate, which is the roof of the mouth, and behind the roof of the mouth, which we call it as a soft palate, and the gums and the back of the throat you can swallow, and sometime around like the what we call it as a real far back and into the larynx. And most recently we had 3 patients back to back, one with an aggressive cancer with what we call it as a malignant cancer or an invasive cancer on the top jaw right here on the back, and then we had another one right on the tongue just less than like about a month ago. And then the most recent one was less than 2 days ago. We had a very young healthy lady, 35 years old. She had a small lump in the back of the roof of the mouth, which we call it as a soft palate. We took a small sample, and the sample came back suspicious, and the oral pathologist recommended it is a possible what we call it as an adenocarcinoma of the soft palate. And we immediately found an oral cancer surgeon, and the patient has an appointment to see the cancer surgeon sometime next week to get that possibly looked out and inspected further, and do a complete evaluation, and possibly get the whole thing removed, and followed by possible radiation and chemotherapy and all of that.
That's right. Well, that's why you get your screenings, you guys. Just as a bonus, we have another question. I read that HPV can cause oral cancer. Can you explain how this happens and if there's a way to check for it?
Okay. So the HPV is one of the most common. HPV is becoming more common, I should say, is for oral cancer. Again, speaking of the oral cancer, it used to be in the past, the people used to think the smoking causes oral cancer, which I'm sure you're probably aware of, and the alcohol causes oral cancer. Between smoking and cancer combined, your risk goes even higher. So now with HPV and what we call it as a human papillomavirus, and there are a variety of or multiple variations of the viruses that are there, and those viruses all can cause cancer, and that increases your risk. And particularly when you are immunocompromised, or when you have a lot of medical conditions or the other medical conditions, for example, when you have diabetes or any other immunosuppression or any other medical conditions that are going to suppress your immune system, now your risk goes even higher. So now speaking of the HPV, so what HPV does is it increases your oral cancer, and then this is one of the most common app questions when people ask, hey, is cancer common on young individuals? Like, what about teenagers, or what about like very young individuals like in your 30s and 40s? And so it is very possible it can happen, but the HPV cancer, the chances of you getting is very likely even when you are very young. And nowadays, people can prevent that from getting the HPV vaccination, and that leads into the question, and why do you need to have the HPV vaccination? Because oral sex is becoming very common, which is one of the main reasons why you are going to get the HPV infection, and that is why before the kids become sexually active, you need to get them vaccinated. So if they are not vaccinated, or you already got the HPV infection, then your chances of you getting the HPV infection goes higher. And if you got the HPV infection, that can cause what we call it as a HPV lesion. I just did this biopsy. This 50-year-old man or 55-year-old man had what we call it as a papilloma, or what we call it as a viral wart on the tongue. And we did the biopsy, and the biopsy came back as a human papilloma virus. And when you ignore those human papilloma viruses, and can those turn into aggressive cancer? And I'm sure you probably heard in the news, and Michael Douglas, one of the Hollywood celebrity, he talks about it all the time. And one of the reasons why he got throat cancer is because of the human papilloma virus. And he's a big advocate of people need to be going to the dentist and the doctor to get the whole mouth or the throat checked out to make sure that they don't have oral cancer. So to answer your question, HPV definitely can put you at a risk of causing oral cancer. Get it checked out. Go to your dentist, and particularly if you have a history of cancer in your family, get it checked out with your dentist on a regular basis every 3 to 6 months, or your doctor every time you go for your physical. Get it checked out as well.
That's right.
Mm-hmm.
Go see your dentist. Get your screenings done.
All right. I think we are coming to an end, right?
We are, yeah.
All right. Well, thank you guys for watching us. And again, was a fantastic show here again tonight. And we look forward to having you guys for next month's show.
That's right.
All right. Let's do it.